everyone, Happy New Year and thanks for watching my vlog, A Dose of Reason. I'm Dr. Shira Doron, an infectious disease physician and the hospital epidemiologist at Tufts Medical Center in Boston. Every week I look forward to answering your questions about the COVID-19 pandemic and sharing my thoughts on the latest news and scientific updates and breakthroughs so you can make the best health and safety decisions for you and your family. You can send me your questions to a dose of reason at tuftsmedicalcenter.org. Please include your first name and your hometown with your question. I'll pick a few questions each week to discuss in the vlog. It's been quite a week. COVID cases continue to rise at a ridiculously rapid rate. It's reached the point where people are talking about that one person they know who doesn't have COVID. It's looking pretty convincing though from lab research that Omicron might actually be more mild, and vaccines definitely protect against severe disease. But even a variant that's half as severe will still overwhelm hospitals if it's twice as contagious, and that's what's happening. The good news is that countries where Omicron arrived early, they're already seeing a decline in cases. No one knows exactly why. This virus is really confusing. So CDC dropped some big bombs this week. Just to be clear though, CDC doesn't make the rules, the state health departments do. So don't everyone run out and do these things just yet. We're waiting for some confirmation. First, they said that healthcare workers could come back to work early. If staffing is an issue, which it is in most places, they could come back on day 6 post-infection. If staffing is an even bigger issue, they don't have to stay out of work at all. Then the CDC announced that all Americans, whether vaccinated or not, could end their isolation after 5 days. That seems like a move toward normalcy and acknowledges that in the post-vaccination era, we don't need to be quite as cautious, and it keeps society from grinding to a screeching halt as the Omicron wave climbs. But along with that announcement was one where they recommended quarantines after exposure and included people who are fully vaccinated but not boosted, people who have been exempt from quarantines for months now. So essentially, they're changing the definition of fully vaccinated without officially doing so. It's going to be really interesting to see how this plays out at the state level. In other news, the first 2 pills to treat COVID have been authorized by the FDA. They're called molnupiravir and Paxlovid, and they'll be in short supply for a while, but hopefully increasingly available soon. We'll start with a twofer. 2 similar questions. The first from Arlene from Marlborough. I'm 68 years old and received a Johnson & Johnson COVID-19 vaccine and booster earlier this month. Now, I understand that my vaccine does not neutralize the Omicron variant. How can I proceed safely knowing that I essentially have little to no protection against this variant? Should I consider myself to be unvaccinated? And Margaret from Brookline asks, I'm 67 years old and got the J&J vaccine and the J&J booster. Now that we're dealing with the Omicron variant, is it recommended or possible for those of us who are seniors and got the J&J booster to get a Pfizer or Moderna booster? If not, what would you recommend we do? I do understand your concern. Research out of South Africa showed that 1 dose of J&J really doesn't provide sufficient neutralizing antibodies against Omicron. But that doesn't mean that once boosted, you are unprotected. First, we don't know how much neutralizing antibody you get out of a J&J booster dose. And second, there's a lot more to vaccine-induced immunity than just neutralizing antibodies. In fact, it turns out even Pfizer boosters lose their effectiveness against Omicron infection by about 10 weeks. But where all of the vaccines continue to perform really well is in their cellular immunity, the ability to prevent severe disease, hospitalization, and death, and that's what matters most. Now, unfortunately, you can't get a Pfizer or Moderna vaccine right now. If you've had 2 doses of J&J, it's just not allowed. But you have the tools to stay safe. A good quality mask, keeping your gatherings small and well ventilated, testing before gatherings, and staying away from people who are sick. Our next question was sent in by Julie from Newton, and she asks, how does one consider boosting older teens, balancing the risk of myocarditis from the vaccine versus the risk of illness or myocarditis from COVID in teens who received the initial 2 shots? Is there data on this? Well, this is probably the hardest question you could have asked me, and it's one I'm grappling with myself. As you know, the CDC now recommends boosters for everyone over the age of 16, but that's not what the members of the External Advisory Committee to the FDA were saying when they met to discuss the authorization of boosters for younger adults. They didn't feel they were necessary for young, healthy people. But of course, that was before Omicron. So healthy teens who have received 2 doses of Pfizer are still exceedingly well protected against hospitalization and death from COVID-19. And now we know that people who had their Pfizer booster over 10 weeks ago are not well protected against mild infection with Omicron. So given that the effect of the booster is likely to be short-lived and that it's not necessary to prevent hospitalization, I'm not convinced that healthy teen boys who are at higher risk than girls for myocarditis after vaccination need a booster at this time, but I'm open to seeing more convincing data, and I fully acknowledge that experts will reasonably disagree on this. Our last question comes from Gail from Dedham. With Omicron being so transmissible, is it safe to attend a funeral where you're close to the family and people are bound to reach out for hugs? There's no way of knowing who is and isn't vaccinated. It's in a small indoor room, and I'm not sure if people will wear masks. Well, Gail, unfortunately with Omicron, being vaccinated is no longer much of a guarantee that a person doesn't have COVID. And there's a lot of COVID out there. I would guess that at a reasonably well-attended funeral, there will be at least one person there with COVID, if not more. So it comes down to this. How important is the funeral to you? Not to other people, but to you. And how much do you care about not getting COVID? I truly believe that everyone is going to get COVID. You're not going to avoid it forever. But if you're not vaccinated and boosted, or if you're immunocompromised or elderly or have other risk factors, you might want to hold on a little longer until we have readily available treatments or better vaccines. And until then, you probably do not want to attend a gathering during this massive Omicron wave. That's all the time we have for this week. You can send me your questions about the Omicron variant, booster shots, COVID testing, or anything else related to the pandemic or infectious diseases to adoseofreason@tuftsmedicalcenter.org. I look forward to dishing out a dose of reason to you again next week.